to provide an instruction video for how to look up your medications and find a plan that's going to work best for you. Go to your web browser. In the address bar, you're going to type in Medicare.gov. And then you'll see over here in the far right corner the login. It's best if you have your own account. You'll want to click there and log into your account. But because I don't have an account, I'm just going to do it from a general search. So I'm going to come to health and drug plans, find health and drug plans. You'll see it's review your 2026 plan options now. And then again, reminding you, you can log into your account here. Make sure you're selecting the 2026. It is already a default. I'm just going to put in a zip code, 89141. And we're going to choose standalone prescription drug plans, which is Medicare Part D like drugs. Find plans. Now this section right here is if you are receiving Medicaid or one of these options here. Extra help is if you had applied through Social Security. It's also referred to as low income subsidy. That is help with paying co-pays and potentially cost of the plan. In this case, we're going to make it simple, and I'm going to choose you don't get help. Hit continue. Yes, we want to compare plans. Next. I'm going to add the drugs. Now, if you're logged in, your drugs should already be listed there. You can modify them yourself because it will keep track of everything you've filled for the year. So for me, I'm just going to go ahead and add in some medications here as an example. And you can choose dosages by clicking this tab here. So grab your bottles and boxes if it's applicable, and make sure you're putting in the correct thing. So if you're getting a 90-day supply, you take one a day. I'm going to change this to 90 and then choose every 3 months. That's the frequency you're filling it. I'm going to add another drug. We're going to put in Repatha. Oops. Again, you can choose the dosage. I'm going to leave it as is for right now. We're going to add another drug. And let's see, levothyroxine. Add the drug. I'm just going to modify this a little bit here and put in 25. And we'll change this to 90-day supply again also. Okay. Let's see. I'm going to add an inhaler just because I'm seeing this as an issue on some plans. Some plans are not covering one of these, if not all of these. Okay, right here is where you're going to see the option to make sure you're choosing the one that you have. So if you have the original box that you had when you picked it up, great. Look at that and make sure you're putting in the right thing. I'm just going to put one every 6 months in this case. Okay. Now scroll down and I'm going to click Done Adding Drugs once you're done. Now put in the zip code where you are, where you live, or according to your street address of your home. Okay. And I'm going to leave the pharmacy name blank for now and click Find Pharmacies. Now this is defaulting to 5 miles from this zip code. If you are doing mail order, you can go ahead and choose that, but I'm going to ignore that for this purpose, and I'm going to pick 3 pharmacies. And the reason you want to pick 3 is so that you can see which ones are preferred per plan. So let's see, I have Walmart, I have Walgreens, and I'm just going to pick CVS also. Now, obviously, if let's say you shop at Smith's and you get them there, go ahead and pick that. I would say pick the pharmacy you're currently using and then add a couple of more options. So down at the bottom, you can see what you've chosen. If you don't want one on there or you want to change it out, just hit the little X mark and then go over to Continue to View Plans. Okay, so now you have at the top, it's warning you you're looking at 2026 plans. And there is an option to print if you're somebody who likes to look at it on paper. And here it's defaulting to sorting lowest drug plus cost of the plan. So this is your copays plus the cost of the premium, which is going to get you the total annual number, which is that second number right there. And then you'll see it's sorting it that way. So the first plan that shows up at the top is HealthSpring Extra. And then you can see from there, you can look at your other options. Now, it is a good idea to potentially compare these, but for right now, I'm just going to click on View Drugs and their costs. And that's defaulting to this drug plan that we were just looking at, HealthSpring Extra PDP. Okay, so that's $52.60 per month. This is the anticipated copay amount for all of 2026 based on that list of medications that I put in. Granted, it's a snapshot of what you're planning on staying on and taking for the next year. Because after January, you cannot change the plan until the following year for open enrollment. Now, if you realize you made a mistake in entering your medications, you see they have a change your drugs button here. You can do that. Otherwise, this is what is in there. So if, for example, you think, oh, no, wait a minute, I get this, I don't know, every 3 months, then you'll want to go up here and do that change drugs, okay? So come down here. It's going to show you on this plan which pharmacies are preferred by this extra green highlight right there. Okay, so that means you can go to either of these and have a little better copay than the standard, they call them standard pharmacies, which in this case would be the CVS pharmacy. Yes, it's in a network, but your pricing isn't going to be, your retail prices aren't going to be as favorable as the other two pharmacies. So now down here, this is one of those expensive drugs, and that's why I entered it, okay? Because you'll see this come up as well, the Medicare prescription payment plan. This was new for 2025 based on the Inflation Reduction Act. What that means is if you can't afford to pay that, you can ask your insurance carrier, in this case, HealthSpring, which is changing from Cigna in 2025 over to 2026. It will be HealthSpring Extra RX plan, okay? You would ask them to put you on the payment plan. In that case, that would spread your payments for that over 12 months. You just have to make sure you finish paying for it by the end of 2026. Okay, so this is your anticipated total year copay expense on this particular plan at each of these pharmacies. Okay, so in this case, Walmart has a little bit better of pricing on some of the medications. Now, let's say you're already at Walgreens, you may think that it's not as big of a deal to change pharmacies. Okay, so let's come down here and we'll look at the total annual expected cost. And this, again, is inclusive of the cost of the plan plus your expected copays for the entire year. Okay, and then you look down and they give you a breakdown per month with each pharmacy that you're going to. And then there are several other options here that you can click and look at, like learn more about why your costs change. And so how this works is there are 3 cost share stages during the year. And first cost share stage would be the deductible stage. So if we look back at the top up here, this plan has a $615 deductible. That is the first cost share stage of the year, but that does not apply to every tier level. Excuse me. Let me come down here farther. Okay, so in this case, I had just happened to know on that plan that the deductible applies to tier 3 and higher. And you see right here, the albuterol on this plan is a tier 4 medication. Levothyroxine, tier 1 for lisinopril, and Repatha is tier 3. So you'll also see there are some prior authorizations and quantity limits, and these are applicable in certain cases. So, excuse me. And then you'll see the stages here that you'll be in. So, initial coverage stage is the copay zone after you meet your deductible. So, in this case, you have no deductible on your tier 1 and 2, which is preferred generic and then generic, respectively. Tier 3s are preferred brand, tier 4s are non preferred drugs, tier 5s are specialties. So, if once you've met the $615 deductible, then you'll pay 17% coinsurance on preferred brand, 30% coinsurance non-preferred, and 25% coinsurance on specialty drugs. Now, your third and final stage of the year is when your cost reaches $2,100 for the year. Then you pay zero for your medications after that. So let's see here. Hold on just a second. Let me just go back to, okay, coming back up here. So in this case, looking at, we'll say Walgreens, these are your anticipated copays per month. That tells me you will more than likely not hit the 2,100 for the year in terms of your cost sharing stages. And then if you click this little underlined link over here, it will just give you another breakdown of what I just talked about. Okay. Now, the reason in this center column here, because it's a non-preferred pharmacy, that you might hit your catastrophic is because you're spending more money at that pharmacy. So you might get to that zero by December because your expenses are higher in general on that using that pharmacy. If you look up here, you can see you're spending about $300 more as compared to Walmart by going to CVS on that particular on this particular plan with your list of medications. Now, if you're not sure that this is the right plan for you still, go back to your search results and you can throw this into a comparison and look at some different plans. So if we come down to the next one on the list, we can throw that up there, and then we'll look at the third one and look at that as well. And then just do compare. If you look at the bottom here, that blue bar, hit compare. And now you can look at them side by side and see if that's going to be the right plan for you or not. And I would say in this case, it will be, or it should be, the right plan because it covers all of your medications. And it has 2 out of those 3 as preferred pharmacies. This Humana Basic is not covering one of those medications. And same with this Value RX plan. And you'll notice it's a 0 per month plan, but I mean, the total annual cost is not that different. It's just here. This video is just to demonstrate how you can do your shopping and then decide, of course, which one's going to work best for you. Now, you can look at plan details on each of these and see, for example, which medication it is that isn't being covered. If I click on that first underline up at the top there in the blue, where you see where it says covers 3 of 4 drugs, there, view drug coverage. You see how it popped me down there to show, okay, see where it shows this albuterol? That's that inhaler is not covered. So that's what's figuring into that total annual cost because the plan isn't going to pay for it. So it's driving up your expense. And you'll also see that the breakdown on these other medications, per pharmacy is slightly higher than the other plan we were looking at. So therefore, my recommendation is if we were doing this together, that you would probably want to choose this HealthSpring RX plan there. But I hope this helps. Of course, please feel free to reach out to me, and I'll be happy to help you.